Everybody, thanks very much for joining us at the weekly Greater Manchester briefing. We're going to split it into two halves today. In the second half, I will be introducing the chair of our newly established race equality panel, Elizabeth Cameron, to speak to you, obviously to coincide with the first anniversary of the murder of George Floyd, and want to provide an update on the commitments that we made at that time with regard to race equality in Greater Manchester. So that will be the second half, but we wanted to devote the first half of today's briefing to obviously the general situation with regard to COVID in Greater Manchester, and I'll invite Sir Richard Lees to update you on the latest statistics in a moment, but also pleased to be joined today by the leader of Bolton Council, David Greenhalgh, and obviously David will have something to say about the Bolton situation, as will I, but we'll come to that in a moment. So I'm going to hand straight over to Sir Richard Lees, lead for health and care in Greater Manchester. So Richard, over to you. On mute, Richard.
Try again. I had unmuted once, but hopefully we're going to go through the slides that many of you will already be familiar with in their form. But I can't see them at the moment. I don't know if they're going to appear. I hope they're going to appear on my screen. So brilliant. Thank you, Jessica. Okay, as always, we're going to start with the prevalence slide, the number of cases per 100,000 population. This is up to the 20th of May 2021. So we've already got some indications of what is likely to happen next. And as you all know, that Bolton really does stand out from everywhere else, and you've seen that very, very rapid increase over a 3-week period. Most other places have also seen an increase over the same period of time, but at nothing like the same rate. And I think Bury, Manchester and Trafford have just gone into the amber range, and a couple of places have even gone down. Stockport and Tameside have both gone down. This does reflect the variant of concern, which is the Indian variant, which is having a differential effect across Greater Manchester. We do expect over the next week, perhaps the 2 weeks, to see again a small rise in the numbers, but all the indications we've got at the moment is that again, excluding Bolton, which David will say a little bit more about later, those are likely to be moderate increases, and I'll talk about the impact on that as we go through the slide set. If we turn to the next slide, the next slide is the over 60s. No, back one. Back. There we go. Over 60s. Again, Bolton is higher than everywhere else, but clearly these numbers are a lot lower, and everywhere apart from Bolton is still in green territory, and it's a territory where even 1 or 2 extra cases a day can make a significant impact to the numbers. I think what this really tells us is that the vaccine has been really effective. These are people who are most likely to have been vaccinated twice, have had both jabs, and it's clearly having an impact both in transmission, but also in virulence, that if people are getting the virus, that they are less likely to become seriously ill as a consequence. So I think although the numbers are going up slightly, this still remains, I think, a good news slide rather than a bad news slide. If we turn to the next one, which I suppose is the most graphic illustration of what's happening, and I'm not going to repeat about the numbers in Bolton, but this shows you where they are. The biggest age is in the 15 and under age group, and that's where the biggest increase has been. Then it's in students working age, and if you look at the 65 pluses, although there's been a small increase there, it is a very minor increase. In the fading that you can see, you'll also see again in other places. If you look in Bury, if you look at Rochdale, if you look at Wigan, look at Tameside, a very small increase in the 16 to 44 age group. That's where cases have tended to be, again, I think, reflecting vaccination. It's not the case that we're not getting any illness. These aren't all asymptomatic. But it's certainly the case that the level of illness is nothing like what we saw in the second and third waves in Greater Manchester. Go to the next slide, which is around care homes. This number has been stable for a while now. You're now in this sort of area that even 1 or 2 cases will add 1 or 2 percentage points here. Remains very, very low. This deals with care home residents, but we'll see similar numbers for care home staff as well, where we've got very low rates there. And in terms of having visitors to care homes, of the care home residents being able to get out, this really is very good news indeed. Move to the next slide. And this is what's happening with our hospitals. Now, given the numbers we've seen in the past, these numbers still remain relatively small, and the overall trend is in the right direction. You'll see a small increase in the number of weekly admissions, very marginal increase in patient diagnosis, and a small increase in the number of beds occupied. That increase in the number of beds occupied is almost entirely the increase, that is Bolton General. I think Bolton General had 41, 42 patients with COVID yesterday. But if you compare that to the peak, that's less than a third of the peak. And that's at a peak when the actual incidence prevalence was lower than it is now. And the big message that even though there is a high proportion of cases, that high proportion of cases is not translating into increases in hospitalisation or significant increases in hospitalisation, and more importantly, not leading to more people being in ICU. So yes, people are getting sick, but now very few are getting seriously sick. Again, in partially a consequence of the age groups that are now getting the virus, but also the impact of vaccination as well. So if we turn to, I think, what's the last slide? And I think if I've got any messages for today, it really is on this slide. Clearly in parts of Bolton, parts of Manchester, Rochdale, Trafford, other parts of Greater Manchester, we are now not only doing surge testing, but we're also doing surge vaccination, where for residents in particular areas that we think are at higher risk, anybody over 18 can get a vaccine, largely through pop-ups, through drop-in centres. We've had people queuing in some cases for an hour and a half, 2 hours. So the take-up has been really, really good. And we are going to keep that going for as long as we can, because the evidence is quite clear that vaccination does make a difference. But if I can turn to the 50 to 69-year-old figure, that's clearly an area where the second doses are still being administered. And anybody who's awaiting a second dose will get a call from the NHS inviting them to go and get their second vaccination. So we don't particularly want people ringing up, but when they do get that call, when they are invited to go for a second vaccination, can I just say, go as quickly as you possibly can, because it does make a real difference. There's research figures being released this week that show, depending which vaccine you're using, that your second dose can increase the immunisation impact by between 2 and 3 times what one dose is. So that second dose really does make a big difference. If you get the invite, please go and get it as quickly as possible. Overall, and the clue is in the language, it's the Indian variant is a variant of concern. It is having an impact on Greater Manchester. More people are showing evidence of having caught the virus, particularly amongst those age groups. But at the moment, it is not having any serious impact on the ability of the NHS in general and the acute sector, our hospitals, to be able to provide services and indeed to get on with the job of recovery and deal with the backlogs accumulated over the last 12 months. We think we can maintain that position, but we can only maintain that position if people do get vaccinated when they have the chance to get vaccinated, if people who have got the virus follow the rules on self-isolation so that they reduce the risk of transmission, and we still continue to be sensible about the way we behave, even though we do clearly have very welcome more freedom now. Let's use it in a very responsible way, wearing masks in public spaces, on public transport, maintaining hygiene standards, and where appropriate, maintaining social distance as well. And I think if we do all of those things, I think we're fairly confident that we will be able to contain this particular outbreak. Thanks, Andy.
Thanks very much indeed, Richard. We'll go straight to Councillor David Greenhalgh, leader of Bolton NBC. David.
Thank you, Andy, and thank you, Richard, for that summary. I want to first of all begin by thanking all the agencies that have come together in Bolton to deliver the surge vaccinations and the surge testing that we've had, the response from Public Health England, NHS, government, coupled with our own officers at our own borough level, coming together, as well as the many hundreds of volunteers that have enabled this to take place. I want to thank everyone, including the response from Bolton people as well, who have responded and have gone and got the vaccine and queued up. And delighted that, you know, over the first weekend alone, we delivered in the region between 6,000 and 7,000 extra vaccines on top of what we were already delivering at many of our hubs throughout the borough. This is obviously the figures and the cases speak for themselves. This is a very challenging time for Bolton, and we will continue to do everything we can. I'm thankful and grateful of the support we've had from GM colleagues in this. We will do everything we can to address these rates, and are doing, working with all communities across the borough and understanding their needs and addressing them. So it continues to be a very challenging time. Clearly, over the last 24 hours, there has been a degree of confusion. But I'm delighted to say, after a series of calls with senior officials from both government, Public Health England and NHS colleagues as well, we are in a position to be able to say with assuredness that there is no added restrictions coming to Bolton. There is no local lockdown. The position in Bolton remains the same as it did at the time of the Prime Minister's announcement 10 days or so ago. And that, of course, has come as considerable relief to myself, who has argued, along with colleagues, about that local lockdowns do not work. We in Bolton have had experience, first-hand experience, and I'm going to say disproportionately and unfair first-hand experience of local lockdowns. They do not work, and I will continue to fight against them. It, if anything, increases the spread. It encourages people to travel across boundaries. The virus does not adhere to local borough boundaries or local county boundaries, as we find ourselves on the edge of Greater Manchester and Lancashire. And I will do everything I can, and hopefully supported by my GM colleagues, to fight against local lockdown. So I will say that it is important that people read the guidance. It would appear that the guidance, which was established and written, first of all, on the 14th of May, was reformatted on the government website late Friday evening. And this is what has caused this recent media stir. I urge everyone to follow the guidance where they can. take personal responsibility. We are in a period now, particularly in Bolton, where we are living with COVID. But while the vaccine appears with all the evidence to be holding up, and that is supported by all the evidence of the relatively low hospitalizations, which, as Sir Richard has just said very eloquently, remains a proportion, a significant, relative small proportion of what it was at the peak. All the evidence points to the vaccine holding out. All our emphasis now must be on the surge vaccinations, surge testing, and the protection of our residents. But while the vaccine holds out and all the evidence points in that direction, I will be arguing against further restrictions and local lockdown to enable our businesses and our economy to get back to some degree of normality. Thank you very much.
Thank you very much indeed, David. And if I might just add to what David and Sir Richard have said, and then we'll obviously open up to your questions. We have been thrown into some confusion overnight, and we've been trying to make sense of things today, as David said. I know that our concerns here in Greater Manchester are shared by mayors, combined authorities in other parts of the country that are also affected. As David said, it would appear that guidance was reissued on Friday, but it has been amended, and it would appear to put more emphasis around travel, and hence the confusion that's been created. Nobody in our system was told about this change in the presentation of the guidance, and I think it was the Manchester Evening News, I think, that first brought it to the world's attention. But since obviously then there's been a huge amount of confusion across the system, and this would appear to be, in my view, a fairly major communications error of the kind that we saw a lot of last year, but we haven't seen recently. But it does have a real impact on people's lives. And I think this is the important thing to say. It doesn't just affect Bolton residents, although it does affect them very much. But people have to remember that Bolton residents work in other parts of Greater Manchester, but other residents of our 9 other boroughs work in Bolton, and there's people travelling around every day, and obviously this impacts upon them when they hear reports of this kind coming out. And it also strengthens David's point that to take one area in isolation is unlikely to work because of all of that cross-border travel that I just mentioned a moment ago. So it has caused a lot of confusion. We're hearing that schools are confused about whether school trips can happen. Amateur sport has been thrown into a little bit of chaos as a result. People will have plans for the bank holiday, and all of it just needs clearing up. It's important that David and his colleagues have had clarification from government. But I would just make 3 points in response to this. Still not to overreact to it, but I do think we need to clear it up and clear it up quickly. If we are now to move forward with the roadmap and everybody to stick to that. I think the first is the government does need to issue a further clarification today, exactly what it means by the guidance, so that the residents of Bolton and beyond are in absolutely no doubt whatsoever what is being asked of them, and the status of the guidance is made absolutely clear to people. And I think that does need to be done by a minister later today, so that everyone knows exactly where they stand, and there is no room whatsoever for any confusion here as we move forward. The second point is that I think we need to clear up a contradiction in government's approach between this guidance and the position of the Department for Education when it comes to schools. So here we have obviously a local piece of guidance, but we are being told by the Department for Education at a national level that there can be no deviation from the national position on schools vis-a-vis the roadmap, where it is being said now that schools should not enforce or require the wearing of face coverings within school. Now, not just in Bolton, but certainly in Bolton, there are schools there and across Greater Manchester that obviously are looking at the local situation and wanting to apply local discretion as to the situation within their school, within their community, and that is entirely understandable and right in our view. The discretion to require wearing of face coverings within the school, the ability to reintroduce testing should that be judged necessary. So Greater Manchester will be putting forward a formal request that we synchronise this guidance that's more general with regard to the community with what the Department for Education are saying. Currently there is a discrepancy between the two, and we believe it's important that our schools are given the ability to use discretion with regard to face coverings and testing, and that is something that Greater Manchester is putting in today. And then lastly, just to very much support David in what he said, I guess there will be a concern out there today that this is a local lockdown by stealth, or the first move towards back to local lockdowns or to the reintroduction of the tier system. I want to support David in saying we do not wish to see any return to local lockdowns. We do not believe that they worked. We believe the situation in 2021, the context is different to the one that we had in 2020. And we believe that that should be made clear as well, because otherwise we will have growing concern amongst businesses about what might lie ahead. So those are my reflections on what's happened over the last 24 hours. As I say, I don't want to overreact, but it's important that this is cleared up very quickly indeed, and we don't have any discrepancy between policy in one part of government compared to another. So I'm going to leave it there. I can sense that you'll be keen to ask questions of us. So Ross, if you would like to field them and pitch them towards me, maybe in the first instance, and I'll decide who best amongst the three of us is able to answer. Thanks, Ross.
Thanks very much, Andy. Could colleagues in the media please indicate if they'd like to ask a question by raising their hand as per the instructions that they've had through. I'll just give you a moment to do that. And I'm going to go to Saika Chowdhury from the Bolton News. If you just give me a moment, you should be able to unmute your microphone now and ask the panel a question.
Brilliant. You've spoken a lot about what you don't want to happen, your wishes and so on. My inbox has been flooded with members of the public calling me, sending emails, ringing my phone, confused, upset, angry. They've made plans for the bank holiday. It's half term next week. You're hoping the government will give clarification. They've been quiet so far. What is your advice to people? People who've been following the rules and they don't know what to make of this at all. Will they be able to invite family members to Bolton? The guidelines say it's essential travel, work or education. That's quite clear in the amended guidelines. That they've spoken to public health, they're not getting any clear answers. And what would you say to them? They are really, really upset.
I'll bring David in straight after Saika, but let me just say what I said a moment ago. People need to know where they stand. And I was reflecting what I thought would be the case with your inbox, because I know people are going to be very confused now about what is being asked of them. And I think the government's attempts so far to downplay it aren't particularly helpful. The government's trying to say, oh, well, there's no change here. It's all the same. But I don't think it is when you look at what has been presented. And obviously the context is different today in which this change has been made, because there are a higher number of cases, as we saw from Sir Richard's presentation. So, the situation has changed. And I do think ahead of the bank holiday, and ideally today, the government should let people know exactly where they stand, what is being asked of them, but making clear that this is not a requirement, as we saw with tiers. This is different. This is guidance, and therefore it's to people's judgment what they should do, and if they are travelling, what precautions they should take. So, I think David and I will be of the same view that we need to obviously ask people to do what is being suggested and to take all of those precautions. But what we cannot have, I don't believe, is the confusion that we've got currently, and it does need to be cleared up. The government minimising it because it might be easier to do that. Well, I don't think that's going to work for the people of Bolton, and I don't think that's going to work for the people of Greater Manchester. They do deserve better than that. But I'll hand over to David if David wants to pick up from there. On mute, David.
Thanks. Thanks, Andy, and hi, Saika. And yeah, my inbox too has been jammed, as you would imagine. I just want to say quite categorically to Bolton, and of course there has been a joint statement by myself and the Director of Public Health and the Chief Executive, which is just very clearly saying that after conversations with senior officials, both of all public health, NHS and government, that our position remains the same as it was. There are no additional restrictions and there is no additional lockdown. This is not legislation and this is no added restrictions to Bolton, so no local lockdown. And that I've also had assurances that should anything even have been in the air that this was going to happen, that of course there would have been conversations that would have taken place beforehand. The message is very clear to the public as far as I'm concerned, that the situation remains the same as of 10 days ago, under the same guidance when the Prime Minister made his announcement, and nothing has changed since then. I would still, as we would always, urge people to follow all the measures that are taken, that we know, to keep them safe and to take on that personal responsibility that is needed now for them to make judgments on where they go, what they do, but that we are not telling them what they have and have not to do. So we will give that personal responsibility to our residents, who have, as I said, the vast majority of them from the very beginning have adhered to all the guidance they've done. So the message is very clear. Keep to your plans, but keep to them safely and responsibly.
Thank you.
Ross, do you want to?
Yeah, thank you very much. Apologies, I was just unmuting. We're going to move on to the next question. Apologies, my system's just running slightly slowly. We'll go to Michael Gaffney. Apologies, no, we'll go to Ellie Linford. Ellie, you should be able to unmute your microphone now.
Thank you. Do we know the figures on whether those being hospitalised have had one or both doses of a jab? And also, how worried are you about Bolton General being able to cope as we maybe catch up between the cases and hospitalisations?
We'll pass that to Richard Alley, if that's okay.
What we're finding at the moment is that unlike earlier waves, that the relatively small number of people are a far wider age range than there were previously. Before, it's predominantly over 60s. We're now finding that it's still very few people, if any, under the age of 35, but there are more 35 to 60-year-olds, and probably in even proportions. So there are some people who've been hospitalised who would have been eligible for one or two vaccinations, but there's probably a bigger number now that are only just becoming able to get the vaccine, and obviously because through surge vaccination that number will increase as well. So we are seeing people who are being hospitalised, that there is an impact of the people who have not necessarily refused to have a vaccine, but because of their age band wouldn't have been entitled to a vaccine. We're also seeing some cases as well where people are getting ill who have been vaccinated, but the level of illness is significantly less than it was previously. So again, that's in general the case, that where people are getting ill, by and large, they're not getting ill in the way they did in the second and third wave.
Thanks very much. Unless any of the panel want to come in, I'll move on to the next question.
Next one, Ross.
So I'm going to go to Kit Vickery from the MEN. Just give me a moment. You'll be able to unmute your mic now.
Hi, I'm just looking for a couple of points of clarification. So David, you've said that there are no extra restrictions in place, but the guidance still says that you should not travel, and you're asking people to follow the guidance where possible. So are people still being asked to not travel in or out of Bolton?
So the position, Kit, is it's this time-old that we've had all the way through the pandemic in terms of guidance and legislation, and people are being asked to make their own decisions on what they see, and it's the difference between must and should. And the guidance is clear for people to act responsibly and make their own decisions around what they consider to be for themselves important to do. But I would say to them, the reason I say about additional restrictions is we have when lockdowns are introduced, they're introduced through legislation, and we're given a time span in which they're introduced by. That's how lockdowns have worked in the past. And we have had no indication whatsoever, and we've had affirmation that this is not any additional restrictions, any additional lockdown measures for Bolton. So there is a balance here of the restrictions that would have to be implemented by law, which there are not in terms of any local lockdowns, but there still is guidance which people are being asked to show personal responsibility for. But it remains the same as it did 10 days ago, in that people can travel in and out of Bolton. That is not affected. I've had it confirmed today. These are not additional, but people are being asked to do it safely and responsibly. And that is my message to the general public.
As far as I understand, the government have said that this guidance was issued to Bolton on the 14th of May, which was 11 days ago. So how does that fit into the situation still being the same as 10 days ago?
Well, the 10 days ago was I did say 10 days or so ago. I must admit, I do lose track of when the Prime Minister last spoke, and it was whenever the Prime Minister last spoke. Kit, you'll forgive me if I've just got the number slightly wrong. But clearly, that the guidance, as I said, it was reformatted on late Friday evening, and that formatting seems to have given a little bit of extra emphasis on the travel. Although if you look at the wording, there isn't a great deal of difference. So this is why I say that this advice has been out there, this guidance has been out there for a number of days now. There isn't that big a difference. The emphasis now is on, rather than going to local restrictions or a lockdown, it's asking people to make those personal choices of personal responsibility themselves. But it is not, and I stress, not in any way adding restrictions or locking us down.
Kit, it's Andy here. So I'd just like to support what David has just said. I think the issue here is the advice or the guidance has been changed, or it's been presented in a different way to people, as David said, with a slight change of emphasis. So that's how it comes over. It's stronger, it would seem, when it comes to travel. But David is absolutely right to say this is not a requirement. Therefore, it is about people's best judgment. But I would just say that has to come from ministers so that people are really clear what is being asked of people. And it just needs to be clarified rather than it being issued in guidance late at night. No one spots it, a slight change of a word here or there. That's how this has arisen. I don't want to as I say, not want to overreact here. We understand how things can happen like this in a situation in which the country is in. However, let's not repeat the mistakes of last year. Let's have this cleared up immediately, ahead of the bank holiday weekend, so everybody knows where they stand. And I would support David in saying, allow people to use their good judgment to make the right calls, balancing their own safety and everybody else's safety, recognising that Bolton is in a different position to the rest of Greater Manchester and most of the rest of the country.
Thanks, Andy. I'm going to move on to Alex Mislin from The Guardian. Alex, you should be able to unmute your microphone now.
Hi, I was just wondering if even accepting that it's just guidance and not restrictions tantamount to a local lockdown, should people in Bolton be cancelling their holidays, both in England and also to other parts of the UK?
Well, David, do you want to take that, or would you like me to?
Well, I would just simply say no, they shouldn't be cancelling their holidays if they've had them planned for half term. Just behave sensibly. There's tests that are required. As long as they do follow the guidance, I do not believe residents in Bolton should be cancelling holidays. If you want to come in, Andy.
Well, I would just support you, David. As you said before, people have just got to exercise good judgment, and given what we've all lived through, people will have laid plans and that they will have arrangements in place for the bank holiday weekend. And I don't think it is reasonable to accept that people will just change all of those plans on the back of something that was issued without sufficient explanation a couple of days ago. So I think you have to work with where people are at the moment. The government has to understand where people are, the way they're feeling about things, their ability to change. The finances is a big consideration as well. So the government needs to work with where people are rather than sort of issuing unrealistic guidance without proper explanation.
Thanks, Andy. I'm going to move on to Michael Gaffney from Global. Michael, you should be able to unmute your microphone and ask your question now.
Hi, Andy. We've got at least 2,000 and probably quite a few more United fans on the way to Poland as we speak for tomorrow's Europa League final. How comfortable are you with people heading to an amber list country in such large numbers? And do you feel we've got everything we need to in place to manage their return safely later this week too?
Well, of course, Michael, we would ask everyone travelling to take all of the precautions, follow all of the advice that they are being given. Again, amber list countries, it's in that same category, isn't it, of not hard and fast requirements, but people using their judgment and doing what they believe to be right to keep themselves and other people safe. So I think it's very important to look at what Sir Richard presented. You know, the picture across Greater Manchester is in some ways, much of it in line with England, in that it's the 9 boroughs are not massively different. And when it comes to the over 60s, we're not massively different. There is clearly an exceptional situation in Bolton, about which we can't be complacent, nor indeed the ability of something similar to emerge in other parts of Greater Manchester. But again, this is not 2020. You know, look at the figures that Richard showed around the success of the vaccination programme. I would ask anyone travelling, and that's not just to Gdansk, it would be to Porto or to anywhere, that obviously there is a necessity to follow what's being asked of people, that, you know, very directly, so that we don't see things escalate from here. But, you know, as I say, people have laid plans, and this is the point, Michael, isn't it? You can't issue kind of what appears to be amended guidance without explaining it properly and expect people all of a sudden to have been able to change things. You know, that's why things need to be cleared up by the government today. But I would ask anyone travelling from Greater Manchester to Greater Manchester, obviously, to bear in mind the situation that we are in.
Thanks, Anne.
Yeah, just add a couple of things, and clearly there is a fairly strict testing regime in place for anybody travelling overseas for whatever reason, including PCR tests before and after. But for the football in particular, virtually everybody travelling to football is travelling in organised parties where they've got very short linger time, that they're unlikely to be mixing to a great extent. So as long as people do behave reasonably sensibly, I would have said that the risk is fairly low, actually, from the fans going to Manchester United fans going to Gdansk. And of course, they're all going back to London anyway, so it won't impact here, will it?
Happy to move on. I'll go to Kate Ferguson. Kate, I'm just going to unmute your microphone now. And you should be able to unmute your microphone and ask your question now.
Can you hear me all right, guys?
Yes, hi, Kate.
Lovely. Can I just please ask David, have you got a bit more info on your talks with ministers this morning? So did they apologise for the way this was sort of snuck out on a Friday night, the chaos it has obviously ushered in? And also, what do you think the danger would be if there was a more formal local lockdown in areas like yours? I think you've discussed a bit in the past that people could have sort of vote with their feet and there might be sort of unrest or protests. Is that your big fear?
Well, in First of all, in relation to your first question, I think there was, all I will say is I think there was general confusion all round at the change in what had happened on the website. So I'll leave it there and leave it for others to maybe comment. But there seemed that was my certainly my when I witnessed what was happening. In relation to lockdown, I think it's very important to understand. I've talked about it before. Bolton has probably spent more time in lockdown than any other area in the country. And since July last year, there really has been hardly any period of time where there has not been some degree of lockdown. And with that, we experienced a considerable amount of that time where our rates were actually lower than many other boroughs who were not having the same level of restrictions. So our hospitality in particular, our businesses, our residents felt they were unfairly treated during that time and were not listened to. Now, I was very vocal at that time. I wasn't afraid to speak up against my own government then. I was very unhappy with the way we were treated. And during that time, human nature is that resentment builds up. And the fear, literally the fear, that we will once again be singled out, and this is no way underestimating the figures that we have. We know these are challenging figures, and as I said at the beginning, we are doing everything we can with the support of all the other agencies, including government, GM, NHS England, Public Health England. We're doing everything we can, but that does not prevent the fear that we will once again be singled out. Many of our residents, the vast majority, have lived and abided by the rules, and they feel then that they are once again being, singled out as a town that disobeys or a town that has to have action taken against them. And I genuinely believe there is an underlying resentment that can very easily, if we are not careful, turn into anger. And I'm doing everything I can, especially when I know in my heart that local lockdowns do not work. I'm doing everything I can to prevent that. I don't think I'm over-exaggerating. I hope I am over-exaggerating in a sense, because I hope it won't even come to anything near that. But I know you only have to look at social media. I know we have to take that with a degree of pinch of salt, but you only have to look at the underlying tensions that are arising, and I'll do everything I can to prevent that. And so that's why I'm fighting tooth and nail to avoid any lockdown, local lockdown, which I know does not work.
Thanks, David. I'm going to move on to Kath Paddison at the BBC. Just say we've got about 3 more questions left, and we've got an important second part of the press conference. So after these 3 questions, we will move on. Kath, you should be able to unmute your microphone now. Kath Paddison, you get your hand up. You should be able to ask your question now.
Yes. Hello, can you hear me?
Yes,
yeah.
Thanks, you can, Kath.
Yeah, you can. So we know that there are more people requiring hospital treatment at the Royal Bolton Hospital from the effects of COVID-19. Now, they've released a statement saying that the pressure is continuing and that they are taking urgent actions. Now, I'm just wondering what your reaction is to that statement.
Richard?
I think I just want to say a bit about the pressure that the acute sector is under at the moment. If you look at overall hospital occupancy, it's in Greater Manchester, it's around about 85%, and the figures for Bolton are within that range, and that's because as the number of COVID cases have gone down, clearly that our hospitals have started that catch-up process for all the electives that have been postponed or delayed as a result of COVID. A lot of people have had delayed seeking treatment because of COVID, have now been seeking treatment. So we're getting pressure on A&E as well. And of course, people are worried, and when people are worried that they will phone 111 or they will turn up at A&E, and we're getting pressure from that as well. So I think As I said, the numbers of patients that are COVID related across the system is relatively low. In Bolton, it's less than a third of what it was at the peak. So we're in that sort of territory. But all of our hospitals, and indeed all of our primary care, are under pressure from the combination of ongoing issues with COVID, coupled with trying to return as far as possible to business as usual.
Thanks very much. Unless there's any more on that question, I'm going to move on to Ella Griffiths from Sky News. Ella, you should be able to unmute your microphone and ask your question now.
Hello, yes, I think I'm unmuted. Andy, I just wondered if you could tell us about sort of when you found out about this new guidance and kind of how you felt, I suppose, and then also, you know, how necessary you feel it is in the parts that are affected.
Well, thanks, Ella. I mentioned earlier that I found out last night from the MEN. I think BBC Northwest Tonight, I think we're also claiming that they broke the story. I'll let the MEN and BBC Northwest Tonight argue that one out. But certainly I found out from the Manchester Evening News yesterday evening. How did I feel? Well, it did feel like 2020 all over again is how it felt. Obviously, that was a common experience last year to hear about changes late at night. And this felt like a return to that. And I immediately thought, well, there's going to be people all across Bolton who don't quite know what to make of it and where they stand. And obviously that's been brought out by David talking about the number of inquiries he's had today, and Bolton Evening News the same. So this is the effect of these things, and it's why I describe it as a failure of communications that does have a real impact on people's lives. But I don't want to be in a position where we overreact to these things, because it's hard always getting the balance right. So I'm obviously throwing the government the benefit of the doubt, but what I am saying to them is clear it up really quickly, and that it can only be done, in my view, by the government just acknowledging if it would appear to be a mistake. Well, why not just acknowledge it and say then exactly what's being required of people. And in terms of more broadly the point that you raised, I'm just with David. Bolton does feel singled out. I know that because I heard that when I was campaigning in the mayoral election. It has had exceptionally difficult circumstances to deal with. People may forget, but hospitality businesses were closed down in Bolton ahead of the whole Tier 3 situation, and they got no compensation at all. And I know that businesses there are still struggling with the effects of that in terms of the hole it created in their balance sheet. So, Bolton has got good cause to feel very fearful of a local lockdown, which would single them out and cause real damage to people's lives, to people's businesses. And it's why David and I are at one on this. We do not want to see any return to that situation. For the reasons Sir Richard has given today, we are in a very different position with regard to hospitals this year than we were last year. There's no complacency here. We of course want to work with the government to get through this. And we appreciate the self-isolation support pilot we were offered yesterday, but it has been fed back to me this morning by some of our team that it still isn't sufficient. So the government still aren't fixing things that they could fix, that are entirely within their gift to fix, that would actually then prevent the spread. It's the case that in the age groups that Richard pointed to, many of those younger people find it extremely hard to self-isolate if they are asked to do so, or if they need to do so. And the programme announced yesterday, while helpful in many ways, it still doesn't make up all of people's loss of income that some people on the lowest incomes face if they're asked to self-isolate. So I think that's the situation that we're in. We don't want to get back into a rerun of events of last year, and I can say that in all sincerity. We need these things just sorted out, and we want to stick to the roadmap. And that, I think, requires the government continuing to work with us. And perhaps be a little more responsive at times to the calls that we make around more local control over testing, over contact tracing, a more effective self-isolation support programme, the discretion that I described that we need in schools. Let's get all of the things that we can fixed, rather than obviously the spectre of local lockdowns being raised again.
Thanks, Andy. The final question in this section is Jessica Hay at Manchester TV. Jessica, you should be able to unmute your microphone now.
Hello, thank you for that. I guess this could go to David or Andy, obviously back linking with the stance on Bolton. As we know, it's only guidance that's been issued, not legislation, and with you both, I guess, making it clear on your views about local lockdowns and that you don't think they work. What alternative do you think can be done to control the spread instead of the possibility of a local lockdown? Obviously, there's been the ramp up of the vaccinations, but do you think that is enough?
Well, I'll bring David in a second, but just to say that, what I was just saying, that list of things that I was just mentioning, we often make half steps on some of these issues around test, trace and isolate, where actually full steps is what we need. And we do need to continue to work with the government on vaccination and getting the supplies into our system, both to get down the age range, but also to ensure the double jabs are done within the new 8-week time frame. So, all of those things should be done as the first resort, rather than the last resort of local lockdowns. And even then, we don't believe it will work. So I think that's where we are. I'll hand over to David. David might want to add to that.
Yeah, just surge vaccination, surge testing, send us the resource to deliver, and we'll try and deliver it at the speed that we can. And coupled with the fact, I think we delivered something in the region of 50,000 tests last week alone. So I think it's just important to understand as well, the vast majority of our cases in Bolton are in the 5 to 10, 10 to 16 and 16 to 30 categories. And that is a hugely important, significant thing. And I just will end, and I know we at GM have been lobbying for this as well. I do hope government will listen to our ask about face coverings in schools. I know it's part of the release as we come out of the roadmap that is no longer a requirement. Clearly, evidence would show in Bolton that we have large numbers of cases, much more than was significantly before in our school age of primary and secondary. And the wearing of face coverings would seem extremely sensible, bearing in mind that information. So that would be an ask. I would ask government to relook at that, particularly in areas like mine in Bolton.
And just to say, we're submitting that ask today, and that is an ask that's going from the whole of the Greater Manchester system. And I think, just in closing, Ross, on this section, I think the message is clear from us as a city region around local lockdowns and not wanting to see any return. So just to re-emphasise that point in closing, because I guess there'll be residents, businesses now across Greater Manchester feeling the uncertainty of the last 24 hours and wondering what it means for them. Do they buy in supplies and stocks? So there is uncertainty, and it does need to be removed. And I think we've made that point pretty clear this afternoon. I don't know if Richard would like to add anything before we end this section.
I think I will add that very simple message, which is to I think repeat that there are things that people themselves can do to make sure that we minimise risk, not only to themselves but to other people. Follow the guidance, follow the rules, be sensible. And as soon as you can get vaccinated, get vaccinated. As soon as you can get your second dose, get your second dose.
Thanks, Richard. Ross, should we move into the second half of this press briefing? And I hope colleagues from the media will stay with us, because it's certainly no less important and a big part of what we've all lived through over the last year. I'm really grateful to Elizabeth Cameron, chair of our race equality panel, for joining us this afternoon. It is obviously the 1-year anniversary of the murder of George Floyd. You might recall on this briefing, actually, a year ago, when on behalf of the other Greater Manchester leaders, I made commitments around what Greater Manchester would do in response to events in the United States and the protest and the passion that we saw here on the streets of Manchester. And I was very clear that it needed to be a case of deeds, not words. There was a sense that a lot of lip service had been paid over the years, but actually where was the action to change the reality, particularly for young Black, Asian, minority ethnic people growing up in Greater Manchester? Where was the commitment to make real change and challenge where we needed to? So the promise we made was to stand up a race equality panel for Greater Manchester at some pace, which we've done, and we're proud of that fact, and we're extremely grateful to Elizabeth for chairing it. I just want to make two further points before I introduce Elizabeth to speak to you. Firstly, that we promised that we would bring forward a regular report around race equality in policing and the potential disproportionate use of police powers against communities, having transparency about the use of police powers across all of Greater Manchester. So you'll know that we've appointed our new Chief Constable, who has taken up office this week. We have agreed with him that the first statistics will be presented to Elizabeth and the panel next month, and the first report will then be published in July. So that's a firm commitment that we're making today, that the first race equality in policing report in Greater Manchester will be published in July. And then secondly, we are now moving forward on the proposal for a civic and political leadership and mentoring programme in Greater Manchester for people from Black, Asian, minority ethnic communities, overseen by Operation Black Vote. They have run similar programmes in London and the West Midlands, I think in Bristol as well, and it's time for Greater Manchester to do the same, to bring forward a new generation of leaders into political life, but also into public services, the private sector more broadly, opening doors that currently, sadly, remain shut to too many people, giving them the support that they need, but also opening up organisations across Greater Manchester to the full range of perspectives that they need to hear. So we are making that commitment to begin recruitment on that leadership and mentoring programme in the summer, so very shortly, and it will be operational from early 2022. So those are the commitments that I can update on today, but without any further ado, I'm going to introduce you to the chair of our race equality panel, Elizabeth Cameron. Elizabeth. On mute, Elizabeth.
Oh yeah, great. I just want to thank you for that introduction, Andy, because some of the things that I would have talked about today definitely impact on what you reported back. And I do have to say that you have been behind us for getting this panel together, and that in myself as a dedicated sort of trade union activist, political activist, social activist for women, for in terms of race, in terms of gender, you certainly have your work cut out for you with the sort of agenda items that I do bring to you. But I say that because I think it's very important that people know that the story we want to tell as being members of racially diverse communities, and we'll discuss that in a minute, because what we should be called has been one of our main subjects, but that nothing is ignored. We have a vast range of experience at the panel. And before we just look into this sort of breakdown on a couple of slides on what the panel does, I'll come on the back of what was said about COVID. Of course, for our point of view, we saw disproportionate deaths in terms of COVID. So our message out to Bolton right now, I have many colleagues there, is that we reiterate our deep concern that you should know the specific communities that might need additional support, that we ensure that the correct PPE has gone out, and additional risk assessments are being taken early on for members of these communities who we already know it's been pointed out, will die disproportionately. So these are the things that in the trickle down actually didn't take place. So this is this point of what Andy's saying between deeds, not words. So the deeds about that is recognizing that's the case, looking at your workforce. If you've got a predominant number there, we're talking about health service, public sector services, ensure those people have had the risk assessments, ensure that they're not being forced to work in the environments that mean that they will be carrying it on. Because what we see is the inequality across health, across housing, crowded housing, insufficient income and poverty pay. And all of these things are what's brought about the greater numbers that we've seen of deaths in those communities. So if we will start at the beginning, that was just my comment about COVID. If we can look at a couple of slides, if that's possible. Thank you very much. So our aims and objectives, as you'll see, they fall largely into the aims and objectives of the Public Sector Equality Duty and the Equality Act 2010. And what we all know is that we would be working in an environment where most services are going to have policies in place, but it's how they carry out in practice. It's are people still getting the jobs? It's are people getting advanced? Are they getting training? Are they getting this equality of opportunity and indeed equity in this community that we live in GM? And that's really what we want to change. And we've got to say that, you know, in terms of that, we've fallen far short. So if we look at the next slide, if you would. But let's talk about what we have done, because it's a big job to do. I'm privileged and proud to be chairing this panel, but I have no doubt that when we are looking at race in its entirety and the impact of living in a racially diverse communities, and in that I am talking about Gypsy Roma, I am talking about Indigenous communities. We have people represented in that panel fighting strongly for people from all the communities and even those most marginalised. So in its first 6 months, yeah, I mean, we've never even had a chance to meet each other face to face. Everything's been online, as you can imagine, but we still managed to pick up a number of key issues for ourselves. We said policing in schools, and I'll say a little bit more about policing when we come off this slide. Homelessness prevention, you've heard me talk about how it relates to our deaths. So let's not skim over that. You know, if I talk about Salford, where I live, I know for a fact that we have less air quality than some people, not only in Greater Manchester, but in the UK at large. Why should people who are poor have less air quality? I mean, that's a disgrace. So gender-based abuse, we're looking at the policy that's coming out, a draft policy, and ensuring that the work that we've done on these issues is being implemented into a new policy. And we have a good representation of people who work with specialised, marginalised services, the type that are in voluntary sector, the type that usually don't get enough money, and I've seen their funding be cut in half. So we are looking at the voluntary sector, and what is the response for the voluntary sector when the share of pie in terms of funding comes down to main services, you know, public sector, and then we're looking at voluntary sector. How many in that voluntary sector are for Black and minoritized services? So bereavement services, again, we're looking specifically at how it affects people in racially diverse communities. The workforce race equality, there's a whole group of people who are looking at workforce race equality on the back of the RES report, which is about health, seeing what was our situation in those public sector services, and can work be done? There's a number of schemes that are in place at the moment. We are looking at the results of those. Did they work? What more can we say? You know, we don't just want pockets of good practice. We want something that goes across the board. So we're looking at a good employment charter, something that can be there for all organisations. As we saw with health and social care, it's required that there is a standard of working which organisations can attain, all organisations. And the Independent Inequalities Commission, well, we thank them for all their work. Lord Simon Woolley, Kate Pickett, and all these colleagues, they came and they allowed us to be part of all those conversations. And you will see the results of that. When we are there, it makes a difference. You read that report and you will see that race is front and centre within that report. The acknowledgement of what needs to be done, really, they said at the GMCA, it should be bravely done, and it has been bravely done. They have talked about aims which we could only dream of. Now, whether they will happen or not is going to be seen over time. And we've got to accept that some of this takes time. So I put inclusive language down there at the bottom, and that's just to say that we've absolutely refused the title BAME. Nobody is permitted to use that title when they come to our panel. We don't recognise ourselves as BAME. We think it's a very lazy term. It's not correct. We are not a minoritized, we are a minoritized group, not a minority group globally. And that's something that we're working on, and there will be more work on that level. So because time is of the essence and I have to be quiet now, I would give my last minute to saying that today I do remember Yusuf Mackey's death. And I remember Debbie Mackey, his mother, who fought for his untimely murder. He was a school child and he was murdered, and she gave the rest of her life to fighting for justice in the criminal justice system, that somebody should walk away from murder with only a 4-month sentence. And the parity of that along people who are black and dealing with such crimes doesn't appear to be the same. The statistics are out there. So I remember her, whose anniversary was yesterday, as I remember today George Floyd, who died not in vain, because we hope that with what the movement that he re-energized in Black Lives Matter, which was there anyway, gave us the opportunity to talk to so many of our circumstances, to so much of the pain and the heartache, actually, that goes with suffering racism on a daily basis. And we do call out racism for what it is. And the Independent Inequalities Commission, commissioned by your GMCA, called out structural racism, called out institutional racism, and they weren't afraid to do so. And that has been endorsed by the GMCA. So the CRED report, I'll just put it on the shelf to gather dust, because I won't be using it for reference, let's say that. So our challenges, just to round up in 30 seconds, really it was waiting for that police report so we can do some of the work on aggressive policing, the use of taser, deaths in custody, and we want to talk about where the action needs to take place, and diversity fatigue. I would have been most upset if the members of this panel today who came to ask questions all left when it got to the second section. I am glad to see that you are here, because it means to me that your organisations do care. They are interested in what's happening in race. There's so many of us who can't now turn off our TV screens when we're bored of it. This is our lives, and we've got a commitment from GMCA. We're working towards some good aims, and we need you alongside us. Thank you.
Thanks very much indeed, Elizabeth. And that very much is our message, our joint message today, isn't it, to all of our communities in Greater Manchester, to say that we mean what we say when we will work together for race equality in Greater Manchester, and hence why on this particular day we've come together, and we hope that message is heard via our colleagues in the media around Greater Manchester. Ross, I'll hand to you. I guess if we could run till say 3:20, but if there are any questions colleagues in the media want to put to myself or Elizabeth.
So if colleagues could indicate if they'd like to ask a question in the same fashion as before by putting their hands up. We've got a few coming in now, so thank you for that. I'll go immediately to Niall Griffiths at the Manchester Evening News. Niall, you should be able to unmute your mic and ask your question now.
Hi there. Can you hear me okay?
We can. We can
Right.
now.
First question to Andy. The first report on the use of policing powers by GMP was first expected to be published by the end of last summer. Why is it so overdue? And to Elizabeth, has the panel had or made any assessment of GMP's policing yet? Are there any early indications of what their record is on this?
Thanks, Niall. I'll go to Elizabeth next. Well, we made the commitment a year ago to bring forward the report, the race equality in policing report. I mean, you might be right in that we may have made it a little bit before that, but we formalised it this time last year. And obviously, we were overtaken by events, firstly with the pandemic, but also obviously some of the difficult issues that Greater Manchester Police has been dealing with since then. But it's why we wanted to just to make it clear now that we have a new Chief Constable in position. We're making it clear to you today that this is an early priority. We recognise it needs to be done to build confidence, and it will be done. So the commitment is to go to the panel next month, publish it in July, and absolutely, Niall, hold us to account on that timetable. Elizabeth?
Yeah, thank you for this question. It's absolutely crucial. I mean, we got the headlines on this report in January, and ever since then we've been asking for the report. Now, we understood that the report was going to take time to redevelop because we made so many comments on the back of it. So if you would say, have we made any assessment? Yes, I can talk about 9 times as likely to be stopped and searched, and a report which highlights some very specific parts of the Northwest where that is prevailing more for young black men from an African or African Caribbean background. Some areas you would see that there will be Pakistani young males who have been more targeted, and we are using the terminology of targeted till we see something to the otherwise. Our assessment at the end of that brief conversation, and it was a brief meeting because the panel had only just come together and was starting to do this work, but our view was that this needed much more than training. Training is required, but we need to look at the deeply held views that cause for reactionary responses from certain areas of policing. So we don't know the detail, and I can't accuse here or there or make any conclusions without that report in my hand. But they were our overall conclusions based on the headlines. Use of taser, again, that looks like to be 4 times, 5 times as likely. In young black males, we know about instances of that. So they were the things we were picking out. And in the absence of that, we do what we can. We were able to be part of the recruitment of the Chief Constable, which raised for us the fact that there aren't enough black officers at a senior enough position to even stand for that position. So that was an immediate piece of work that goes to our employment work that we'll do. And we also were able to ask very hard questions that talked about the communities feeling that they've been absolutely failed by the police. And I'm going to say that was allowed and endorsed by both the Deputy Mayor and the Mayor. They did allow me to ask the hard questions that the panel required. I won't give you all of them, but all candidates were asked those questions and were made to respond as to how they would engage the communities that feel so disenfranchised right now. I hope that answers the question.
Yes, thank you.
Thanks very much. We'll move on to Michael Gaffney from Global. Michael, your microphone can be unmuted now and you can ask a question.
Hi, Elizabeth, just picking up off the back of Niall's question, when you were having those difficult, challenging conversations with the force, what was the quality of the conversation like?
From my point of view, we've got a hell of a way to go. We really have. I can't judge on somebody who's just come here, who has a record of brilliant work. That's what I have to say about who we've got in charge now. They have a superb record of being able to turn very difficult forces around and get some decent results. For me, my mission was to ensure that the communities I represent, who I believe are the most disenfranchised within the policing system and indeed the justice system, I'll go further, that has to change. And there's no time to be slow about it. There's some immediate actions that need to take place. And we spoke very, very straightforwardly about that and didn't have to hold back, because we can back up, if you will, everything we're saying, not just with add-on statistics, but actual people, names and places. So when you're talking about that, you're going to be including things like joint enterprise and the impact of that. That really did, you know, I can't even get into what the communities would think. I have to truthfully represent what the picture is going to be for this new person in post. And we'll see. You know, I don't think there's any reason to be unfair to somebody new coming into a job. But I certainly won't be holding back in terms of representing the communities. There'd be no point. I'm here to challenge, constructively challenge. I don't need to throw eggs at people, but I can be very clear in my words. And I will be hashtag taking the knee, and I will be saying hashtag Black Lives Matter today, because they do, and they need to matter all the time. And what we see as evidence is they haven't mattered, and not only that, they've been singled out for treatment is the impression of people. So that's what we need to change. Thank you.
Michael, if I could just support Elizabeth and what she just said, because I explicitly said to Elizabeth and the panel that we want them to challenge. You know, the panel are not there to pat anybody on the back. They can if they want, but they're there to challenge. That's the whole point of the panel, but as Elizabeth just said, in the right way, so that we bring people with us and we get the kind of change that we need to see. And I know the new Chief Constable has given clear commitments that he will attend the panel on a regular basis, as will I, as I hope will all senior people in Greater Manchester, to be challenged, because that's what we need to be, is challenged. But I just want to say something, you know, because you know, there's a sense sometimes that everything that GMP is doing is wrong. Well, it's just not, it isn't the case. And on this issue of a more representative and diverse workforce, actually GMP has made the fastest progress on this over the last 6 years. Representation for ethnic minority black police officers went from 4.9% of the entire workforce to 8.2%, and it's still rising. And it's rising actually fastest this year. The expectation for 2021 is that 17.5% of new recruits will be from black, Asian, or minority ethnic backgrounds. So actually on this, GMP deserves credit. I was at Bolton for the swearing in of the new cohort of officers in late 2019, early 2020. And, you know, what walked through the door was the next generation of Greater Manchester fully represented. And it was a fantastic thing to see, young men and women, but also from all backgrounds. So, you know, Greater Manchester Police has got some way to go, as we all know. But on this issue, it has made more progress than others, and as you will see from the figures I've just given, more progress is still coming. So I think, you know, that does need to be recognised. But Ross,
no, I think that's fair to say. Sorry.
Thanks, Elizabeth. I think we're a little over, aren't we? So I can't see any more questions, colleagues. Thank you, all of you, for attending today. There's a lot we've thrown at you there. As ever, we appreciate your attendance. Elizabeth, particular thanks to you for coming today. I don't know if you want to say anything else.
I just wanted to add that the fire service, yes, you're absolutely right to highlight that. You know, I wasn't really here to represent that job, and that wasn't what I was asked. But the fire service has done a fantastic job. It's taken Jack Effiong in post. She's done this equalities work, and it has changed the organisation intrinsically, and it shows you the difference of being there. And it really, really, that's something we cannot forget. And we cannot forget that the only reason Derek Chauvin went to jail is because of a secret video that was taken on somebody's phone. And that shouldn't be where justice rests. So it's in those terms that my work continues. But yes, clearly, GMP has made some progress, and I don't think it would be fair to say anything otherwise. So yes, thank you.
Thanks, Elizabeth. But more is, of course, needed. And colleagues, we will bring the race equality report to you as soon as it's available in July. But Ross, I think with that, I'll thank everybody for their attendance and close this press briefing.
Thank
you,
you,
everybody. Thanks.
Thank you very much for listening.